Good day, everyone. Welcome back to our series of research discussion. And before we finally leave the phase two of quantitative research process, which is the design and planning phase, let us have another moment and discuss the concept of measurement, which is vital before we dig deeper into data gathering methods and procedure. An understanding of measurement principles is crucial in the data collection phase of a study. Research variables, as we know it, must be operationally defined, and when we say operational definition, we as researchers indicate how the variables under study will be observed or measured. That's how we define operational definition, right? Now, for this lesson, it is structured in two parts. After my short introduction about measurement, we will have the first part, which is about level of measurement. And the second part is about data collection instrument, wherein we will focus on reliability and validity. So let's get started. As an overview, we define measurement as the process of assigning numbers to variables. Ways to assign these numbers include counting, ranking, and comparing objects or events. Now, measurement, as used in research, implies the quantification of information. So this means that numbers are assigned to the data. According to Niswiadomi 2018, some qualitative studies, this is for qualitative studies, gather data in narrative form, and numbers are not associated with these types of data. Thus, the narrative types of data that are collected from qualitative studies are not included in the concept of measurement in her book that we use as one of our references. However, keep this in mind, you should know that if qualitative data were summarized and placed into categories, they would then fit the criteria for measurement. So in the classic sense, measurement implies that some kind of comparison is made between pieces of information, and numbers are the means of comparing this information. Let's go over the advantages of measurement. First advantage, it removes guesswork and ambiguity in gathering and communicating information. So consider how handicapped healthcare professionals would be in the absence of measures of body temperature, blood pressure, and so on. So without such measures, subjective evaluations of clinical outcomes would have to be used because measurement is based on explicit rules. Resulting informations tend to be objective, which can be independently verified. So two people measuring the weight of a person using the same scale would likely get identical results. So that's one advantage of using measurement. We are objective, and the data that produce is not ambiguous. Second, it helps obtain reasonably precise information. Instead of describing, for example, na Nathan as tall, we can depict him as being 6 feet 3 inches tall. So if necessary, we could achieve even greater precision. So in short, using measurement, we are more precise. We can give the exact information that is needed. Okay, and then number three, measurement is a language of communication. Numbers are less vague than words and can thus communicate information more clearly. If the researcher reported an average temperature of 99.6 degrees Fahrenheit, there is no ambiguity. Instead of saying na somewhat high, di ba? Pag sinabi mong somewhat high, that is vague. That is, we cannot determine exactly what is that somewhat high is. Pero when you say the average temperature of 99.6 degrees Fahrenheit, then it is exact. Okay, so the communication delivered is clear. Okay, so these are the advantages of measurement. So we now proceed to the first major part of this topic, the types of mathematical calculations that can be made with data depend on the level of measurement of the data. So four levels or classes of measurement or measurement scales, yung other term for this, have been identified. So we have nominal, ordinal, interval, and ratio. I know that you have already encountered this during your senior high school in your subject research or in your statistics. So somehow this is a form of review on your part. So we start with nominal level of measurement, wherein objects or events are named or categorized. Remember that the categories must be distinct from each other. We mean mutually exclusive categories, and include all of the possible ways of categorizing the data, or in other words, exhaustive categories. So there may be only two categories or there may be many categories, and numbers are obtained for this type of data through counting the frequency or percentages of objects or events in each of the categories. So yun yung pwede nating um, magawa in terms of the data collected for nominal measurement. So we can count the frequency or use percentages. Examples of types of nominal data are, ito yung mga ginagamit natin usually for nominal. We have gender, religious affiliation, marital status, and political party membership. So the researcher could count the number of males and females in a study and report this as percentages or frequencies. Aside from this, no other mathematical operations could be performed with this data. So you may have noticed that these types of variables are frequently assigned numbers on questionnaires, such as halimbawa 0 for males and 1 for females. So that's how we see oftentimes, no, when we accomplish questionnaire, na kapag male, 0 yung naka-tag as a symbol, or 1 for female. So these numbers are again only symbols. So they could be interchanged and used for data analysis purposes and have no quantitative meaning. Okay, so some types of nominal data may appear to contain what we call real numbers. Examples are zip codes and social security numbers. Actually, these numbers are symbols and can be placed only into categories. So they should not be added or subtracted. And finally, the nominal level of measurement is considered the lowest level or least rigorous of the measurement levels. So for the second level of measurement, you have ordinal. So data that can be ranked, ordered, as well as placed into categories are considered to be at the ordinal level of measurement. The exact differences between the ranks cannot be specified with this type of data. The numbers obtained from this measurement process indicate the order rather than the exact quantity of the variables. For example, anxiety levels of people in a therapy group might be categorized as mild, moderate, and severe. It would be appropriate to conclude that those individuals with severe anxiety are more anxious than those individuals with moderate anxiety. In turn, moderate anxiety sufferers in the group could be considered more anxious than group members with mild anxiety. You could not, however, determine the exact difference in anxiety levels of any individuals within each of the categories. So frequency distributions and percentages are used with this type of data as well as some statistical tests. So parang yung kay nominal measurement natin kanina. Another example, a researcher orders people from heaviest to lightest. So that would fall under ordinal measurement then. Next, interval level of measurement. Interval data consists of real numbers. So may real numbers na tayo dito for the interval level. So interval level of measurement concerns data that not only can be placed in categories and rank, but also the distance between the ranks can be specified. So we can again specify the distance na when we talk of interval measurement. So the categories in interval data are the actual numbers on the scale, such as on a thermometer. If body temperature, for example, was being measured, a reading of 37 degrees Celsius might be one category, 37.2 degrees Celsius might be another category, and 37.4 degrees Celsius might constitute a third category. The researcher would be correct in saying that there is a 0.2 degrees Celsius difference between the first and second category and between the second and third category. The researcher could even go one step further and find the average temperature reading. Take note na at the interval level, a zero entry simply represents a position on a scale. The entry is not an inherent zero. So, kapag may nakita tayong zero for the interval measurement, again, it's just a simply, or a simple representation of a position on a scale. So, it's not an inherent zero. Other example pa natin na magpo-fall under interval measurement include most educational and psychological tests. So, yan for our interval measurement. Ratio level of measurement na tayo wherein the data collected are considered the highest or most precise level of data. It includes data that can be categorized and ranked. In addition, the distance between ranks can be specified, and what is referred to as a true or natural zero point can be identified. So the 0 point on the ratio scale means there's a total absence of the quantity being measured. So kapag ka 0 sa ratio measurement, it's totally, it's a total absence of the quantity being measured. So yun yung kaibahan niya sa interval measurement. Halimbawa natin, the amount of money in your bank account could be considered ratio data because it is possible to be zero, as in empty, wala talaga. Similarly, if a researcher wanted to determine the number of pain medication requests by patients, it would be possible for some patients' requests to rank at the natural 0 point because they request no pain medications. It is a ratio level if it makes sense to say that one value is twice that of another. Again, another definition or description natin for ratio measurement is that if it makes sense to say that one value is twice that of another, then it is ratio. Example, 1 milligram is, 100 milligram is twice as much as 50 milligrams. Okay, so that is a ratio measurement. There is a debate about classifying some data as interval or ratio. For example, should weight be considered as interval or ratio data? Most authors classify weight as ratio data. However, when measuring humans, can someone have no weight? Although it may be great fun to debate about whether a certain piece of data should be classified as interval or ratio. For research purposes, it is really unimportant. Again, it is really unimportant to distinguish between these two levels of measurement. The same statistical test may be used with both types of data. So for both ratio and interval measurement. So another note, researchers usually strive to use the highest levels of measurement possible, especially for their dependent variables, because higher levels yield more information and are amenable to more powerful analysis than lower levels. As our application, so we have here the study of Leon and co-researchers 2008 examined whether there were different patterns and levels of cytokines between women with breast cancer and women with a negative breast biopsy. In the context of this study, the women's breast cancer status was a dichotomous nominal level variable. Stage of cancer, stage 1 through 4 for the women with cancer was an ordinal variable naman. And the women's age and cytokine levels, for example, interleukin 6, were ratio variables. So there were no interval level variables in this study. So this is our example of the levels of measurement. And we have here the summary of all the levels of measurement that we just discussed. So the table summarizes which operations are meaningful at each of the 4 levels of measurement. For example, for nominal, we can put data into in categories. However, we cannot arrange them in order, subtract data values, and determine whether one data value is a multiple of another. While for ratio, all parameters that I just mentioned are all applicable. Again, remember when identifying a dataset's level of measurement, use the highest level that applies. So I just included here another reference you can use for this slide. Kindly read na lang independently for your information or FYI na lang. Let's talk about converting data to a lower level of measurement. Data can always be converted from one level to a lower level of measurement, but not to a higher level. Interval and ratio data can be converted to ordinal or nominal data, and ordinal data can be converted to nominal data. Halimbawa, the number of requests by patients for pain medication could be converted to ordinal data. Requests could be categorized as follows: more than 10 requests per day, that's one category. 5 to 10 requests per day, another category. And 0 to 4 requests per day, third category. This would be an instance of converting interval data to ordinal data. It would also be possible to change this data to nominal data by classifying the subjects into two groups naman. Those with no requests per day, that is one, and the other one is those with one or more requests per day. So that's how we convert yung sa ginawa na nating ordinal data, that's how we can convert that into nominal data pa. So rarely do researchers convert higher levels of data to lower levels, however, because precision is always lost. So sinabi na rin natin kanina yung information na yun. Since you're already familiar with the levels of measurement, you may wonder how one should determine which level of measurement to use in a study. The main considerations in determining the level of measurement for data are: 1, or letter A, the level of measurement appropriate for the type of data that are being sought. Again, yung una mo i-consider is yung level of measurement that is appropriate for the type of data that are being sought. Some variables, by their very nature, can be measured at only one level. For example, gender can be measured at only a nominal level. A person is either a male or a female. So, yun na yung pinaka-appropriate sa kanyang type of level of measurement. Second, or letter B, na you have to consider in determining the appropriate level of measurement is the degree of precision that you desire when it is possible to consider the data at more than one level of measurement. Again, it's all about the degree of precision desired. If the researcher is very concerned about the precision of the data, the interval or ratio level of measurement should be selected when possible. If rank or categorized data will be sufficient to answer the research questions or test the research hypothesis, ordinal data may be used. Finally, if categories of data are all that is called for, nominal data will be appropriate. As our example, if the researcher were trying to determine the differences in the number of complications experienced by patients with diabetes who have varying blood glucose levels, accuracy would be very important. The two categories of elevated and non-elevated blood glucose levels, which is nominal data, would not be precise enough for making comparisons among the patients. The operational definition of the variable will determine the level of data that will be gathered. So much for the levels of measurement. The next part of our discussion is about data collection instrument. Proceed na tayo sa second part of our discussion. When we talk about research instruments, it is also termed as research tools, and they are the devices that we use to collect data. The instrument facilitates the observation and measurement of the variables of interest. Tandaan natin, the type of instrument used in a study is determined by the data collection method or methods selected. Again, kung ano yung type na instrument na gagamitin mo it is determined by the data collection method that you will be selecting. For instance, if physiological data are sought, some type of physiological instrument will be needed. If observational data are needed to measure the variable, some type of observational schedule or checklist will be called for. One area of the research over which the investigator has a great deal of control is the choice of the data collection instrument. And great care should be taken to select the most appropriate instruments. So tayong mga researchers, yung magse-select ng instrument that we can use for our data collection. So you have to be very careful and considerate, no, in choosing the research instrument to be used in your study. So we have to plan carefully and wisely kung anong research instrument ang inyong gagamitin. According to NIS Piadomi 2012, there are three criteria for selection of the instrument. First is practicality, second, reliability of the instrument, and validity of the instrument. Our main focus here is the reliability and validity of the instrument. However, before the researcher examines the reliability and validity of an instrument, questions should be asked about the practicality of the tool for the particular study being planned. Pag practicality of an instrument concerns its cost and appropriateness for the study population. So yung gastos and appropriateness of the instrument para sa study population. That is under practicality. So how much will the instrument cost? How long will it take to administer the instrument? Does the researcher require special training to administer or score the instrument? If so, is this training available? So, yun yung mga pwedeng itanong natin for practicality. Halimbawa, napili nyo to use the psychological instrument such as the Minnesota Multiphasic Personality Inventory or the MMPI. Is money available to purchase the instrument? And is someone available who is qualified to analyze the data? So these are very important questions. The researcher must attend to the practicality of the instrument. So for instance, you have considered already the practicality of the instrument that you will use. Next thing to look at is the reliability of the instrument. The researcher is always interested in collecting data that are reliable and that the reliability of a quantitative measure is a major criterion for assessing its quality. Our definition, reliability is the consistency with which an instrument measures the attribute or variable. The reliability of an instrument concerns its consistency and stability. For example, if a scale weighed a person at 120 pounds 1 minute and 150 pounds the next, we would consider it unreliable kasi nagbago siya from your previous measurement. 120 pounds noong unang minuto and then afterwards naging 150 pounds after, for example, several minutes. So that is unreliable. Pabago-bago siya ng binibigay na data or na weight ng person. Another, if you are using a thermometer to measure body temperature, you would expect it to provide the same reading each time it was placed in a constant temperature water bath. So regardless of the type of research, the reliability of the study instrument is always of concern. Reliability needs to be determined whether the instrument is a mechanical device, a written questionnaire, or a human observer. So the less variation an instrument produces in repeated measurements, the higher its reliability. Again, let me repeat that statement. The less variation an instrument produces in repeated measurements, the higher its reliability. Kung konti lang naman yung differences, no, negligible lang, for example, a 1 or 2, then masasabi natin reliable yung instrument. So it doesn't have to be exact all of the time or most of the time. For instance, yung sa weighing scale natin kanina, if halimbawa yung measurement ko is 120 pounds and then after several minutes naging 123 pounds, then the difference is somewhat hindi naman nalalayo masyado. So negligible na yon. So pwede natin somehow ma-consider that instrument as already reliable. As long as hindi masyadong malayo yung difference. The degree of reliability is usually determined by the use of correlational procedures. Again, the degree of reliability is usually determined by the use of correlational procedures. And a correlation coefficient is determined between two sets of scores or between the ratings of two judges. The higher the correlation coefficient, the more reliable is the instrument or the ratings from the judges. Although correlation coefficients can range between -1 and +1, correlation coefficients computed to test the reliability of an instrument are expected to be positive correlations. So, positive yung ina-expect natin for correlation coefficient. According to Pollitt and Beck, 2008-2012, it is risky to use an instrument with a reliability lower than 0.70. That's according to Pollitt and Beck. So these authors have cautioned researchers to check for reliability as a routine step in all studies that involve observational tools, self-report measures, or knowledge tests because of their susceptibility to measurement errors. Be cautious about the reliability of instruments. Reliability is not a property of the instrument that, once established, remains forever. Reliability must continually be assessed as the instrument is used with different subjects and under different environmental conditions. An instrument to measure patient autonomy might be highly reliable when administered to patients while in their hospital rooms, but very unreliable when administered to these same patients while lying on a stretcher outside the operating room waiting for surgery. Researchers should choose the most appropriate type of reliability for their particular studies. We are going to discuss three different types of reliability here: stability, equivalence, and internal consistency. Researchers should choose the most appropriate type of reliability for their particular studies. So, punta na tayo sa next slide. Starting with stability. The stability reliability of an instrument refers to its consistency over time. It is the extent to which similar results are obtained onto two separate occasions. Assessments of stability are made through test-retest reliability procedures. So again, ang ginagamit natin to assess for stability is by using test-retest reliability procedure. Researchers administer the same measure to a sample twice and then compare the scores. So, ganun ginagawa yung test-retest reliability. So, we administer the same measure or questionnaire to a sample twice and then compare the scores. Some of the problems here are the observations that some subjects may be able to recall certain items given during the first administration of the test, and that the scores may differ because the students have adapted to the test already. A physiological instrument such as a thermometer should be very stable and accurate. If a thermometer were to be used in a study, it would need to be checked for reliability before the study began and probably again during the study. That is test-retest reliability. That is for the instrument. Questionnaires can also be checked for their stability. A questionnaire might be administered to a group of people, and after a time, the instrument would again be administered to the same people. If subjects' responses were almost identical both times, the instrument would be determined to have high test-retest reliability. If the scores were perfectly correlated, the correlation coefficient or coefficient of stability would be 1.0. Ayan. So, for stability again, ang pwede nating ginagamit dito for the assessment of stability is test-retest reliability. So, ang mga pwede natin paggamitan noon yung mga physiological instrument like thermometer or yung mga devices natin in the hospitals, and then yung mga questionnaires that we use sa mga um, sa mga For example, psychological assessment natin or mga ginagamit natin na mga mga tools to measure, for example, anxiety or um, for example, self-esteem. So we can subject them to stability. And again, we use test, retest, reliability. The interval between the two testing periods may vary from a few days to several months or even longer. This period is a very important consideration when trying to determine the stability of an instrument. The period should be long enough for the subjects to forget their original answers on the questionnaire, but not long enough that real changes may have occurred in the subject's responses. Many nursing studies are concerned with attitudes and behaviors that are not stable, and changes would be expected on two administrations of the same questionnaire. Stability over time, therefore, may not be the appropriate type of reliability for a research instrument when you anticipate a change among the respondents over time. Tandaan po natin yon. Research instrument, I mean, reliability for a research instrument when you anticipate a change among the respondents over time may not be appropriate. Example we have here in this slide, suppose we were interested in the stability of a self-report scale that measured self-esteem. Because self-esteem is fairly stable attribute that does not change much from one day to another, we would expect a reliable measure of it to yield consistent scores on two different days. As a check on the instrument's stability, we administer the scale 2 weeks apart to a sample of 10 people. Fictitious data for this example are presented in this table. The scores on the two tests are not identical, but on the whole, differences are not large. Researchers compute a reliability coefficient, which is a numeric index that quantifies an instrument's reliability to objectively determine how small the differences are. Reliability coefficients designated as R range from 0 to 1 or I mean point 0 to 1. The higher the value, the more reliable or stable is the measuring instrument. And in the example shown here, the reliability coefficient is 0.95, which is quite high. Remember, reliability coefficients higher than 0.70 are often considered satisfactory, but coefficients greater than 0.80 are far more preferable. This is one way on how we can compute for the reliability of our instrument. So this is test, retest reliability. This is how we can do the type. Okay, this is how we do the procedure. Test, retest, reliability. I just included here in this slide another actual example of test, retest, reliability. Please be guided na lang and as your additional reference. Equivalence reliability na tayo, the second, concerns the degree to which two different forms of an instrument obtain the same results, or two or more observers using a single instrument obtain the same results. The degree of error can be assessed through interrater or inter-observer reliability procedures, which involve having two or more trained observers or coders make simultaneous, independent observations. An index of equivalence or agreement is then calculated with this data to evaluate the strength of the relationship between the ratings. When two independent observers score some phenomenon congruently, the scores are likely to be accurate and reliable. Ito yung process no, for equivalence. When two forms of a test are used, both forms should contain the same number of items, have the same level of difficulty, and so forth. One form of the test is administered to a group of people. The other form is administered either at the same time or shortly thereafter to these same people. A correlation coefficient or coefficient of equivalence, yung tawag natin, is obtained between the two forms. The higher the correlation, the more confidence the researcher can have that the two forms of the test are gathering the same information. So yung process na yon na binanggit ko is used when we have two different forms of an instrument. So iba yung sa sa interrater or inter-observer reliability, wherein it involves having two or more trained observers or coders to make simultaneous independent observations. So yun yung dalawang process na pwede magamit for equivalence. For the interrater or interobserver, they are using they use the same instrument. We only have one instrument, and then they evaluate that one instrument. Whenever two forms of an instrument can be developed, this is the preferred means for assessing reliability. Again, kung makakapag-develop ng two different forms of instrument, that is more preferred for assessing reliability. That is for equivalence. However, researchers may find it difficult to develop one form of an instrument, much less two forms. Kaya, mas common itong interrater or interobserver reliability. In this slide, we have another actual example of equivalence utilizing interrater reliability. Again, for your reference. The third type of reliability is internal consistency reliability or scale homogeneity, which addresses the extent to which all items on an instrument measure the same variable. It is appropriate only when the instrument is examining one concept or construct at a time. It is concerned with the sample of items used to measure the variable of interest and is the most widely used reliability approach among nurse researchers. If an instrument is supposed to measure depression, for example, all of the items on the instrument must consistently measure depression. If some items measure guilt, the instrument is not an internally consistent tool. In the case of an instrument that contains subscales, kung may mga subscales yung instrument, such as an instrument that measures anxiety in terms of the state of anxiety and the trait of anxiety, you could calculate the internal consistency of both subscales. It is actually evaluated by calculating coefficient alpha or Cronbach's alpha. Again, internal consistency is evaluated by calculating the coefficient alpha or Cronbach's alpha. It is the best means of assessing an especially important source of measurement error in psychosocial instruments, which is the sampling of items. Internal consistency, reliability, our actual example. It was used to evaluate the psychometric properties of the vitality scan, which is intended to determine possible signs of stagnation in one's functioning related to sustainable employability. Coefficient alpha revealed an internal consistency reliability of 5 subscales with acceptable to good reliability. Cronbach's alpha is 0.72 to 0.87. So this is our example of um, internal consistency. So that ends for the our discussion for the reliability. Again, we have three types of reliability. First, we have stability. Next, you have equivalence, and you have internal consistency. Validity of the instrument na tayo. This is another aspect to consider in selecting or evaluating a quantitative instrument. The validity of an instrument concerns its ability to gather the data that it is intended to gather. The content of the instrument is of prime importance in validity testing. If an instrument is expected to measure assertiveness, does it in fact measure assertiveness? Another example, when researchers develop an instrument to measure hopelessness, how can they be sure that resulting scores validly reflect this construct and not something else, such as depression? It is not difficult to determine that validity is the most important characteristic of an instrument. The greater the validity of an instrument, the more confidence you can have that the instrument will obtain the data that will answer the research questions or test the research hypothesis. Just as the reliability of an instrument does not remain constant, neither does an instrument necessarily retain its level of validity when used with other research participants or in other environmental settings. When attempting to establish the reliability of an instrument, all of the procedures are based on data obtained through using the instrument with a group of respondents. Conversely, some of the procedures for establishing the validity naman of an instrument are not based on the administration of the instrument to a group of respondents. Validity may be established through the use of a panel of experts or an examination of the existing literature on the topic. Statistical procedures, therefore, may not always be used in trying to establish validity as they are when trying to establish reliability. When statistical procedures are used in trying to establish validity, they generally are correlational procedures. Four broad categories of validity are considered here. You have phase, content, criterion, and construct. Phase and content validity are concerned only with the instrument that is under consideration. Criterion and construct validity are concerned with how well the instrument under consideration compares with other measures of the variable of interest. Isa-isahin natin. Phase validity muna tayo. An instrument is said to have phase validity when a preliminary examination shows that it is measuring what it is supposed to measure. In other words, on the surface or the face of the instrument, it appears to be an adequate means of obtaining the data needed for the research project. The phase validity of an instrument can be examined through the use of experts in the content area or through the use of individuals who have characteristics similar to those of the potential research participants. Because of the subjective nature of phase validity, this type of validity is rarely used alone. May pagka-subjective siya. Another description, phase validity is also known as logical validity. It involves an analysis of whether the instrument is using a valid scale. The procedure calls only for intuitive judgment Just by looking at the instrument, the researcher decides if it has face validity. So, kaya siya sabi nating subjective. It includes the font size. Ito yung mga tinitignan. Spacing, the size of the paper used, and other necessary details that will not distract respondents from answering the questionnaire. It's according to Kobizin and Borich 2007. As our example from Chippendale 2015, he or she sought to establish face validity of an outdoor false questionnaire that was formulated from the results of a qualitative study that explored the experience of older adults in their neighborhood in relation to a perceived outdoor fall risk and fall prevention strategies. Changes in the original questionnaire were based on a survey design experts' recommendations after a review of the question, a review of the questionnaire for language, structure, and order of questions. So that is face validity example. Second, we have content validity, which is concerned with the scope or range of items used to measure the variable. In other words, are the number and type of items adequate to measure the concept or construct of interest? Is there an adequate sampling of all the possible items that could be used to secure the desired data? Yung mga questions that we can ask for content validity. There are several methods of evaluating the content validity of an instrument. Letter A, or the first method, is accomplished by comparing the content of the instrument with material available in the literature on the topic. A determination can then be made of the adequacy of the measurement tool in light of existing knowledge in the content area. For example, if a new instrument were being developed to measure the empathic levels of nurses in hospice settings, the researcher would need to be familiar with the literature on both empathy and the hospice setting. A second way to determine the content validity of an instrument is through the use of panel of experts. 3 to 5 experts, and should be an odd number. So 3 to 5. A group of people who have expertise in a given subject area. These experts are given copies of the instrument and the purpose and the objectives of the study. They then evaluate the instrument, rely on their logical judgment, usually individually rather than in a group. Comparisons are made between these evaluations, and the researcher then determines if additions, deletions, or other changes need to be made. In addition to method 2, an instrument's content validity is necessarily based on judgment. No totally objective methods exist for ensuring the adequate content coverage of an instrument, but it is increasingly common to use a panel of substantive experts to evaluate the content validity of a new instrument. Researchers typically calculate a content validity index, or CVI, that indicates the extent of expert agreement. We have suggested a CVI value of 0.90 as a standard for establishing excellence in a scale's content validity, and that is from Pollitt and Beck 2006. Example of using a content validity index: Bu and Hu 2008 developed a scale to measure nurses' attitudes toward patient advocacy. The content validity of their 84-item scale was rated by 7 experts. Again, it's an odd number, should be an odd number. A bioethicist, patient advocacy researchers, measurement experts. the scale's CVI was calculated to be 0.85. In this slide, our reference according to Cristobal 2019. It is advised that when a drafted questionnaire is to be subjected for validation, a rating sheet of the acceptable of the indicators must be provided for the experts to mark and give his or her judgment. The markings and comments of the experts that validated the proposed questionnaire will be the basis of the revision of the proposed instrument or questionnaire. So you can see here the markings. You have highly acceptable, acceptable, less acceptable, not acceptable, and you have each item here. So the panel of experts will rate their score depending on the content of that item, if it really measures the variable under study, and then they can include their comments here. A third method is used when knowledge tests are being developed. The researcher develops a test blueprint designed around the objectives for the content being taught and the level of knowledge that is expected. Example, retention, recall, and synthesis. This is like when we create TOS or TOS for a test. The actual degree of content validity is said to possess some degree of validity that can only be estimated. Ang pinaka-common sa tatlo is itong letter B, the use of a panel of experts when we assess our instrument for content validity. Third type of validity na tayo is criterion validity. It is concerned with the extent to which an instrument corresponds to or is correlated with some criterion measure of the variable of interest. You are just correlating or comparing your made questionnaire to that of available standardized questionnaire. So, yun yung ginagawa natin for criterion validity. Kino-compare natin siya to a standardized questionnaire na ano na, I mean, approved na and standard ginagamit na. Criterion validity assess the ability of an instrument to determine the research participants' responses at the present time or predict participants' responses in the future. These two types of criterion validity are called concurrent and predictive validity, respectively. Sa next slides, we'll have a separate discussion for concurrent and for predictive. So note that the difference between predictive and concurrent validity is the difference in the timing of obtaining measurements on a criterion. So again, two types of criterion validity. Let's discuss first concurrent validity. It compares an instrument's ability to obtain a measurement of participants' behavior that is comparable to some other criterion of that behavior. For example, a researcher might want to develop a short instrument that would help evaluate the suicidal potential of people when they call into a suicide crisis intervention center. A short, easily administered interview instrument would be of great help to the staff, but the researcher would want to be sure this instrument was a valid diagnostic instrument to assess suicide potential. Responses received on the short instrument could be compared with those received when using an already validated but longer suicide assessment tool. If both instruments seem to be obtaining the essential information necessary to make a decision about the suicidal potential of a person, the new, shorter instrument might be considered to have criterion validity. The degree of validity would be determined through correlation of the results of the two tests administered to a number of people. The correlation coefficient must be at this 0.70 to consider that the two instruments are obtaining similar data. For example, a psychological test to differentiate between patients in a mental institution who could and could not be released could be correlated with current behavioral ratings of healthcare personnel. That is for the concurrent validity. The second type of criterion validity is predictive validity, which is concerned with the ability of an instrument to predict behavior or responses of subjects in the future. If the predictive validity of an instrument is established, it can be used with confidence to discriminate between people at the present time in relation to their future behavior. This would be a very valuable quality for an instrument to possess. For example, a researcher might be interested in knowing if a suicidal potential assessment tool would be useful in predicting actual suicidal behavior in the future. Another example, kay Kubizin and Borish 2007, it refers to how well the test predicts the future behavior of the examinees. This is particularly useful in aptitude tests, which are tests to predict how well test takers will perform in some future setting. The fourth type of validity is construct validity. And of all the types of validity, construct validity is the most difficult to measure. Construct validity is concerned with the degree to which an instrument measures the construct it is supposed to measure. A construct is a concept of abstraction created or constructed by the researcher. Construct validity involves the measurement of a variable that is not directly observable, but rather is an abstract concept and derived from observable behavior. One method to measure construct validity is called known groups procedure, in which the instrument under consideration is administered to two groups of people whose responses are expected to differ on the variable of interest. For example, if you are developing an instrument to measure depression, the theory used to explain depression would indicate the types of behavior that would be expected in depressed people. If the tool was administered to a group of supposedly depressed subjects and to a group of supposedly happy subjects, you would expect the two groups to score quite differently on the tool. If differences were not found, you might suspect that the instrument was not really measuring depression. Factor analysis is the second method for construct validity. It is a method used to identify clusters of related items on an instrument or scale. This type of procedure helps the researcher determine whether the tool is measuring only one construct or several constructs. Correlational procedures are used to determine if items cluster together. This one is an example of factor analysis for your independent reading na lang din. So, ayun na yung ating different types of validity. Before we proceed with the relationship between reliability and validity, let's just have a summary of what we have discussed for reliability and validity. For reliability, we considered the three types of reliability. You have stability, wherein we specifically discuss how to assess for the test-retest reliability. So that is under stability. Next, you have equivalence. For equivalence, it could either be we use two forms of instrument administered to the same group of people. And then, pwede rin interrater or inter-observer who validates the same instruments. So, pareho yon will fall under equivalence. And then the third type of reliability is internal consistency. For validity naman, we discussed four types. Face validity is number one. Second, you have content validity, where we discuss three methods for content validity. And content validity is the most common. First method is literature. We use existing literature. Second is we use panel of experts to evaluate our instrument or questionnaire. And then the third type of content is using test blueprint. Another type of validity, the third type that we discuss, is criterion validity. For criterion, we have two methods for that. You have concurrent and predictive. So yung concurrent, ito yung we compare yung bagong gawa na questionnaire natin to an existing standardized questionnaire. Yung predictive naman, if is the ability of the instrument or questionnaire natin na makapag-predict of a future behavior. And then finally, the last type of validity that we discuss is the construct validity. And under this, we discuss two types or two methods. You have the known groups procedure, wherein we administer the questionnaire or instrument to groups na alam nating magkaiba yung kanilang magiging response sa instrument. And then the other type of construct validity is factor analysis. So yun, yung apat na validity, phase, content, criterion, and construct. For reliability, yung three na discuss natin again is stability, equivalence, and internal consistency. So let's now proceed to the relationship between reliability and validity. So reliability and validity are closely associated. They are not totally independent qualities of an instrument. Both of these qualities are considered when selecting a research instrument. A measuring device that is unreliable cannot possibly be valid. An instrument cannot validly measure an attribute if it is erratic and inaccurate. Reliability is usually considered first because it is a necessary condition for validity. An instrument cannot be valid unless it is reliable. Again, an instrument cannot be valid unless it is reliable. However, the reliability of an instrument tells nothing about the degree of validity. In fact, an instrument can be very reliable and have low or even without validity. Again, an instrument can be very reliable and have low or without validity at all. Suppose we wanted to assess patients' anxiety by measuring the circumference of their wrists. We could obtain highly accurate and precise measurements of wrist circumferences, but such measures would not be valid indicators of anxiety. Thus, the high reliability of an instrument provides no evidence of its validity. Low reliability of a measure is evidence of low validity. In other words, a valid instrument is always reliable. A reliable instrument is not always necessarily valid. This is most especially true when the subjects are human, who are governed by judgment and prone to error. In actuality, validity is often considered first in the construction of an instrument. Ito yung nangyayari in reality. Face validity and content validity may be examined, then some type of reliability is considered. So, pwede face validity ka muna, tapos content validity, and then magprocess ka ng isa sa mga reliability types natin. So, pwede yun as in validating your questionnaire or instrument. So, face validity, tapos content validity, and then pwede kang, for example, equivalence or test-retest or internal consistency. Either of the types na na-discuss natin for the reliability. The process is not always the same. The type of desired validity and the type of reliability are decided, then the procedures for establishing this criteria for the instrument are determined. A word of caution about using the term establish in regard to reliability and validity of instruments. Strickland 1995 stated that reliability and validity cannot be established because there is always an error component in measurement. She wrote that it is more correct to use terms like supported, assess, or prior evidence has shown instead of saying na establish. Okay, so the next two slides are additional notes about validity and reliability for your independent reading and references. So this slide is about interpretation of reliability coefficients for your independent reading and additional reference. And the next is interpretation of validity. So kindly read na lang. Please take time to read all the details for this and the previous slide. And we have reached the conclusion of our discussion. Thank you for taking time to listen. If you have questions, kindly raise them to me during our synchronous meeting. God bless you and ingat lagi.